How's it going? My name is Dr. Malik Parker. I'm a physical therapist and persistent pain coach. I specialize in helping active people dealing with persistent hip pain or lower back pain get back to a life without limitation. And today we're going to be talking about glute tendinopathy. Got a question from Helen. She asks, what are the best exercises for tendinopathy? How do you tell if an exercise is good or bad? Sounds like clamshells haven't been super helpful in her case. And how do you sleep with glute tendinopathy? So we're going to try to break that down and answer a few questions. First, we're going to talk about what is glute tendinopathy? How do you know if you have it? Because sometimes maybe it feels like glute tendinopathy, but it isn't really glute tendinopathy. And then how do you treat it if you do have it? What are the best exercises for tendinopathy? And why is it quite a bit different than non-tendon related conditions? And then how do you sleep with glute tendinopathy? Is there a certain position you should sleep in? And if not, how do you tell what's the best position for you? Quick disclaimer, although I am a licensed physical therapist, everything I say or recommend is purely for educational purposes only. It's best practice to consult your personal healthcare providers before you make any changes to your treatment plan or routine. So first, what is glute tendinopathy? So what even is tendinopathy? Well, we break down the word. Tendon has to do with the muscles attaching into the bone. So muscles have tendons attach to bone, and that helps to kind of anchor it to the bone, creates a focal point for force. And apathy comes from Latin, which means disease or disorder or suffering. And in this case, we can think of tendinopathy as a disorder of the tendon. So when you go and try to use your glute muscles and engage a lot of force, for some people this will be more force than others, you're gonna feel pain or discomfort because those tendons aren't able to accept that load properly. Your body will use that pain as a warning sign to try not to get you to do too much. In this case, those tendons need to be remodeled, and we'll talk about that. But first, maybe it's not tendinopathy. So how do you know if it is or it isn't? Tendinopathy, in my opinion, is way overdiagnosed. There are a lot of other things that can masquerade as tendinopathies. Really, anytime your body is in a more defensive or guarded state, for a nerve issue, a joint issue, even a non-structural issue, muscles can tense up and they can create pain that feels like a tendinopathy or weakness that feels like a tendinopathy. So how do you know if you have it or you don't? Unfortunately, MRIs are not the best at diagnosing this because those same findings on the MRI that suggest a tendinopathy are found on people without pain almost as much as they are on people with pain. And so since the MRI is not quite reliable in this case, there are three things that suggest that you may have a tendinopathy. The first is that pain is generally hyper-localized to the tendon. So if it's your glute muscle, it may be the attachment points where you're feeling most of your pain, and it doesn't tend to shift around. It stays pretty concentrated to a specific area. It's not like you feel it sometimes in your outer hip, sometimes in front of your hip, sometimes in the back of your hip, sometimes in your lower back. That's not a tendinopathy. Tendinopathies are localized to the tendon, and this pain with tendinopathy in most cases will come and go based on your activity. So usually there's some consistent patterns that you feel trigger it when you're using the muscle maybe more intensely, maybe even when you're going up and down the stairs, maybe when you go for a run, maybe when you're lifting at the gym. When the force you're trying to output exceeds what your body is comfortable with for that tendon, it'll trigger pain. And that's usually pretty consistent. And it's usually not present when you're just at rest. So like if I had a glute tendinopathy, it wouldn't be present with me just sitting down or just lying down because I'm not engaging the muscles. Pain tends to be more intermittent. However, if you overexert it, then it can become more constant when it's in an acute inflammatory state. And the last thing is that stretches just don't really help this condition. So how do we treat glute tendinopathy? Treating glute tendinopathy requires sufficiently loading the tendon to remodel it, and you're gonna walk a tightrope where you need to load it enough where you feel some discomfort, but not too much where you flare it up. If you don't load it enough, it's not going to remodel and it's not going to get better. So you kind of walk this fine line, and generally I recommend keeping the symptoms in a 4 to 6 out of 10 range when you're doing your strengthening exercises. Beyond this, it's probably too much. If it's sharp, likely too much. And if you're not feeling anything when you're doing the exercise, then it's probably not enough to help remodel. So what then are the best exercises for treating a glute tendinopathy? Really, consistency is the most important thing. Are you consistently loading that tendon to the point where you're challenging it but not inflaming it? And so consistency in that 4 to 6 out of 10 zone is key. And that's more important than having a magic exercise because there are a lot of exercises that target the glute muscles. We'll go over some, but really the best exercise is one that you can do consistently and that's easy for you to implement once or twice a day. In the earlier stages, start with isometrics like bridge holds, abduction push-outs into a wall, where you're isometrically engaging the muscles. And this is going to depend more on if it's your glute max, which is the bigger glute muscle and is responsible more for extending your leg, versus if it's the glute med or the glute glute min, which are more responsible for abducting your leg. In the beginning, holding long duration isometrics for 30 seconds to 45 seconds can help even to alleviate some of the pain that you feel if it's in a very easy to trigger state. And as you progress, you'll move into more concentric exercises, double or single leg depending on where you are. And for these, I like to keep it simple, doing double or single leg box squats, just using your chair. And I also like to do step ups forward and to the side. Really, the important thing is following the guidelines, making sure that the exercises you're doing in the part of the recovery that you're in is keeping you in that 4 to 6 range, not too easy, also not too intense where it's flaring you up. And afterwards, after you do an exercise, you should not feel discomfort that lasts for more than 5 to 10 minutes. If you do, you probably overdid it. If you don't feel any discomfort afterwards, it's not necessarily a bad thing, as long as you felt something during the exercise. And tendinopathies are really one of the only maybe 2 conditions where I recommend that you do have to push into that pain a little bit. Of course, this is best to do working with a licensed professional. So after the concentric exercises start to get easier, you can always progress those. So for example, if you were doing chair box squats, you can lower the height of the chair. You can increase the height of the step that you're stepping up. You can switch from a double leg to single leg. And from there, you can move into eccentrics, which is controlled lengthening and is a little bit more challenging than the concentrics. And then from there, you can move into more dynamic and plyometric movements like single leg hops and things like that. So the progression for me would be isometrics, something concentric, varying the height to make it more challenging. And then after progressing through that, focusing more on the eccentric, slow controlled lowering. And then from there, depending on what you're looking to get back to, moving into more plyometrics. If at any point during your progressions, the tendon becomes inflamed, then take a day or two, rest, ice, and once you're ready to resume, dial it back a little bit and progress a bit slower. Even in the later stages, when you're doing more of the concentric or eccentric exercises, you can always still go back to those isometrics to help modulate some of the pain a little bit during more functional activities. Like for example, maybe you have to go and walk up a bunch of stairs, or maybe you're being active. You can use those initial isometric exercises like bridge holds or hip abduction push outs into a wall in order to help modulate the pain with the activities you're doing those 45-second holds and doing a few reps of those. So keep in mind that tendinopathy follows a different set of rules than most other conditions. For really almost everything else where you don't have to progressively load the tendon, we don't always want to be producing that 4 to 6 out of 10 pain. In fact, it's usually quite the opposite. We're usually looking for exercises that are alleviating pain. So very different. If you do not have glute tendinopathy, you do not want to be doing this. This could just be irritating your central nervous system if you're trying to stress the tendon and it's not really a tendon issue. Highly recommend you work with somebody who is monitoring what you're doing and your progress. And although glute tendinopathy exercises aren't really designed in most cases to make you feel immediately better afterwards, like some stretches might be, you don't want any exercise you're doing to make you feel immediately worse. All right, so how do you sleep with glute tendinopathy? There's no single best way to sleep with any condition. It's really about how your body is responding to the different positions that you're in or the surface that you're on. Your body will give you feedback and you make adjustments accordingly. So if laying on the affected side is bothering you, then you may want to lay on the opposite side, lay on your stomach, lay on your back. The most neutral positions will be laying on your back with a pillow underneath your knees or laying on your side with a pillow between your knees, but this doesn't necessarily mean that this is the best position for you. You need to test different positions and interpret your body's feedback. So it's really not about the condition that you have, it's about listening to your body and understanding what variables are in your control, and your variables that you can change are position. So if sleeping on your affected side hurts, try sleeping in another position, or try changing the surface that you're sleeping on. So maybe you can't find a comfortable position. Doesn't matter if you're on your back, your side, your stomach. In that case, you might want to try changing the surface. Simple things you can do to change the surface with very low effort are rotating the mattress, flipping the mattress, or putting on a mattress topper, or simply just trying to sleep on a different surface for a couple days and seeing if that makes a difference, whether that be a couch or another guest bed or something like that. So that's all I got for you today, kind of a brief overview on glute tendinopathy. So I hope that was helpful for you. If you want your own question answered, feel free to reach out to me and let me know.